Good afternoon, one and all. So, I hope yesterday we have completed some part of the exercise system. Today, we are going to start the next sort of questions important for the mm, examination point of view, MTG level 1 questions. Coming on to this, starting fourth, the glomerular filtrate is composed of urea and uric acid only. Uric acid and ammonia, urea, uric acid and ammonia and water, and urea, uric acid, glucose and water. So glomerular filtrate generally consists of components of glucose, water along with the urea produced from the liver and also the uric acid. So we can go with the option for this answer, fourth option. No. Coming on to the next question, which of the following is not a basic renal function? Reabsorption is the function. Perfusion means moving out. So renal function, not a basic function, not a basic function, not a basic function. Here we can go with the option for this answer is perfusion. Perfusion is not the basic function. It is an additional function, but it is not the main function. Next, what is removed from the filtrated loop of Henle? Already you know that concentration of urine is done. Concentration of urine means nothing but removal of water. Removal of water is done in the loop of Henle. Either electrolytes are removed or water are removed, and especially the water is removed for concentrating the urine. Next, the main function of Helen's loop is conservation of water, filtration of blood, passage of urine, formation of urine. Formation of urine is the secondary function. Main the water osmotic balance is to be maintained. So here the conservation of water is the primary function of Helen's loop. Helen's loop. Next, reabsorption of chloride ions from the glomerular filtrate. Reabsorption of the chloride ions from the glomerular filtrate in the kidney tubule of mammal is carried out by osmosis, active transport, Brownian movement, diffusion. We never come across the Brownian movement in this chapter, but we come across the diffusion process, osmosis, and active transport. But reabsorption of chloride ions is by a diffusion process only. So C is the right answer. C is the right answer. Next, coming on to the next question. Ultrafiltration is determined by ultrafiltration is determined by ultrafiltration means fine filtration where glomerular GHP is involved, CHP is involved, COP that is CHOP, colloidal hydrostatic osmotic pressure, blood pressure, so that is CBOD is also involved. So all the three options are involved. So the best suiting option for this is all of these. So this is the right answer. Next, coming on to the next one, which of the following is an incorrect option? So please note that incorrect option regarding tubular secretion. So tubular secretion, it K plus ion is a act urea diffusion ascending limb of phenyl. K plus ion passive transport PCT. K plus ion is actively transported or actively taken in the DCT, distal convoluted tubule. So here this option is looking to be the right option, and K plus occurs in DCT. Next, the ability of producing concentrated hypertonic urine in invertebrates generally depends on the ability of producing concentrated area of Bowman's capsule. It is only filtration. Length of the proximal convoluted tubule. Length does not makes the length of the, already we have discussed that the length of the Helen's loop makes the more concentrated urine, as the length of Helen's loop is small in the case of frog. They will leave more amount of water and they live in the water condition. So length of the Helen's loop is the indicative factor for the concentration of urine, whether water to be conserved or not. Next, which of the following part of renal tubule corresponds with the osmotic concentration of the filtrate present in it with respect to blood plasma PCT hypotonic, ascending limb of loop of anal hypertonic, descending limb of loop of anal hypotonic, distal convoluted tubule isotonic. Renal tubule correctly matches with the osmotic concentration. Correctly matches. So if you read the question and try to understand, you can get the answer that distal convoluted tubule isotonic nature is correctly matching with that. Next, which one of the following are not reabsorbed in the proximal convoluted tubule? So potassium and chlorides, phosphates and bicarbonates and hormones, sulfates and creatinine. Already we know that creatinine and sulfates are not absorbed. So D option. Next, select the mismatched pair. Mismatched pair. Okay, try to find out the mismatched pair. PCT, absorption of place. DCT, absorption of glucose. Secretion or reabsorption of glucose takes place, not absorption. So DCT is the right option, mismatched pair here. Next, which of the following statements is correct? Is correct. So when you're talking, Lasse's cells of JGA function as chemoreceptors that feed the juxtaglomerular cells. PCT have numerous mitochondria for reabsorption of salt by active transport. Both glomerular hydrostatic pressure and capsular hydrostatic pressure oppose glomerular filtrate. Tubular secretion takes place by both diffusion and, so when you see that this option is right, glomerular hydrostatic pressure and capsular hydrostatic pressure oppose glomerular filtrate. So GHP is equal to CHP minus BCOD, like that you have turned. And coming on to the next one, A1. This is also, Lasses is also right, and the B, C, D are right, and PCT have less number of mitochondria for reabsorption of salts by active transport. So here not numerous, it is less. Here numerous is wrong. So here 46th question. In the ascending limb of loop of Hanel, the maximum osmotic difference that can be created by the NaK plus pump is approximately, so according to the textbook that we know that is 100 milliosmoliters. In kidneys, glucose is reabsorbed mainly by Bowman's capsule, loop of Henle, proximal convoluted tubule, distal convoluted. Glucose is reabsorbed in proximal convoluted tubule. That already you know the answer. Next one, 48 question. 48 question. Which of the following has the highest concentration of urine? Already, because hepatic vein carries the components from the liver to the liver liver to the other parts, liver to the kidney to the respective duct. So hepatic vein we having the concentration of urine rather than the hepatic artery. Next, glomerular filtrate resembles the blood plasma in its composition except for the absence of glomerular filtrate resembles the blood plasma in its composition only except in the case of water composition. Water composition. So it differs the GFR and blood plasma almost same, but water content is generally less in glomerular filtrate. Water content is generally less in glomerular filtrate. So when you are reading the statement 50, read the given statement and select the correct option. Statement A. The final reabsorption of water from the urine into the blood occurs through the collecting duct of mammalian nephron, resulting in the production of hyperosmotic urine. The loop of Henle creates a sodium gradient in the interstitial fluid. Whether these statements are right or wrong. The final reabsorption of water from the urine into the blood occurs through the collecting duct of mammalian nephron, resulting in the production of hyperosmotic urine. The loop of Henle creates a sodium gradient in the interstitial fluid. So here generally both statements are right. Statement 1A is right and statement B is incorrect. Statement A is incorrect and statement B are incorrect. So here both the statements, whatever we are saying, are right. This because it is going to take place exactly as it is. Next, liquid which collects in the cavity of Bowman's capsule is that is blood plasma, nothing but the glomerular filtrate. Plasma minus blood proteins and blood cells is called as glomerular filtrate. So this is the most important component for GFR definition. So please remember that. Next, effective filtration pressure EFP in glomerulus is caused because of what? Powerful pumping action of heart, secretion of adrenaline, efferent arteriole in slightly wider than the efferent arteriole, vacuum develops in proximal convoluted tubule and sucks the blood, fall in glomerular filtration rate activates. So here the answer for this question is efferent arteriole is slightly wider than the efferent arteriole. Next, A fall in glomerular filtrate rate activates. Already you know that renin is going to be activated, and that renin is from the juxtaglomerular cells release that. So here we can go with the option A for this answer. Next, hippuric acid, creatinine, and ketones are added to the urine through either by selective reabsorption, glomerular filtration, or tubular secretion. Already you know that glomerular filtration and tubular secretion both can do this function. So B and C option and D option is the right option. Option D is right. Next, select the incorrect statement. Please find the difference. Incorrect. So we'll generally read it as correct statement. Don't read it as correct statement. Read it as only the incorrect statement. And regarding mechanism or urine formation of man. So the glomerular filtration rate is about 125 ml per. The ultrafiltration is opposed by colloidal osmotic blood pressure of plasma. Aldosterone induces greater reabsorption of sodium. The counter current system contributes in diluting the urine. So here incorrect statement. The counter current system contributes in concentration of urine, not dilution of urine. So here the D option is the right option. D option, it is not helping in diluting, it helps in concentration. Next, read the given statement and select the correct option. Salt reabsorption occurs by passive transport. Helen's loop is lined with the scattered. So here both the statement A and B are correct. A is the correct explanation for B. B is not. A is correct and B is correct, but B is not the correct explanation for A. So assertion and reason question or statement questions, you need to take the upper one into consideration and then find out the answer. Just try to find out the answer for this question. So here, when you look onto these particular statements, both are right only, but A is not supported with the statement B because linking words are absent. So your statement B is the right answer. Means statement A and B is not supporting the explanation of A. Next, the GFR of a healthy man. Already you know that GFR means 125 milliliters per minute. So this is the only answer where you can come across. Next, which of the following statement is correct? Is correct. So water reabsorption from the descending limb of loop of water water reabsorption from the descending loop of anal and collecting duct occur under similar conditions. Sodium reabsorption in ascending limb of loop of anal collecting duct occur under similar conditions. Water reabsorption in descending limb of loop of anal and collecting duct occur at different conditions. Water reabsorption in limb and sodium reabsorption in ascending limb of loop of anal occurs under similar similar conditions. So when you try to see this water reabsorption water reabsorption in descending limb of loop of any collecting vector under occurs under similar conditions, and remaining all other statements are to be, correlated wrong options. These three may not occur. Which is correctly matched? Correctly matched. Here you just try to see that correctly matched. Glomerular filtrate serum with protein. Okay, some soluble proteins are there. Glomerular filtration rate 180 liters per day. Reabsorption collecting tubule, reabsorption, reabsorption of Cl, passive transport or by diffusion process already we have discussed. So here only the glomerular filtration rate, that is 180 125 ml per liter per day, per minute, or 180 liters per day is the right answer. Next, urine formation takes place by, so urine formation by jerks, it doesn't happen at intervals, it doesn't happen, it is a continuous process, and it is a drop by drop process which takes urine formation in gush or to fill the urinary bladder at a time. It is not also possible in the system. It is only possible by drop mechanism. Drop by drop mechanism. Next, which of the following is the correct pathway for passage of urine? Already you know that: collecting tubule to ureter, ureter to bladder, bladder to urethra. So this is the answer for that question A. Kidneys help in the conservation of useful material and excretion of waste, and therefore they receive 20% of the heart output of the blood, as much as the heart and brain combined. On a percentage basis, which substance is most completely reabsorbed by kidneys? So you can see that the most of the component absorbed is the glucose in the system. Glucose is going to be absorbed in the system. Next, this is a diagrammatic representation of a nephron. So here they have given the diagrammatic, in this diagrammatic representation of nephron, you can see that A, B, C, D, E are given. So relating to this, we'll try to see the options. So there are certain options given, like question number 63. This is the site of ultrafiltration. The site of ultrafiltration, particularly sensitive to ADH, the main site for reabsorption of glucose and amino acids, largely responsible for the maintenance of blood pH. So here what options will be suiting with A, what will be with B? So the site of ultrafiltration is Bowman's capsule. So A is the answer for that. And the second one, that is particularly sensitive to ADH, is from the diagrammatic representation E, that is collecting duct. And 3 is the main site for reabsorption of glucose amino acids is proximal convoluted tubule. And the fourth one is the distal convoluted tubule, where the largely responsible for maintenance of blood pH. So here we can go by selecting the options, we can go with the option A. Next, Excretion of potassium is governed by primarily by potassium reabsorption in potassium re- reabsorption in proximal convoluted tubule, potassium secretion in proximal convoluted tubule, potassium secretion in distal convoluted tubule, potassium reabsorption in distal convoluted tubule. So DCT potassium is going to be secreted. K plus ions are also going to come out. So here the C option, potassium secretion occurs in the distal convoluted tubule. Next, enzyme from kidney is already you know that it is only renin. Next, vasopressin released from the neurohypophysis is mainly responsible for facultative reabsorption of water through Helen's loop, obligatory reabsorption of water through Bowman's capsule, facultative reabsorption of water through DCT, obligatory reabsorption of water through PCT. So here facultative reabsorption of water through DCT takes place. Next, function of ADH, antidiuretic hormone, is reabsorption of water. Reabsorption of water is the primary function of this. Next, volume of urine is regulated by dash hormone. You know that aldosterone, vasopressin, or the ADH. So this is also called as vasopressin. Next, deficiency of ADH leads to formation of copious quantity of dilute urine, that is greater than 2 to 15 liters of urine, frequent mycoturation because of excessive pressure on the urinary bladder, feeling instable, satiable, thirsty, that it can be also seen in sugar and here also. So here all these three conditions are going to be seen in the in these. All these are going to be seen. What is true about atrial natriuretic factor? So atrial natriuretic factor is released when increased amount of blood enters into the atria of the heart. It brings about vasoconstriction and blood pressure rises. Urine formation is increased. It resembles renin-angiotensin mechanism in effect. So ANF is released when increased amount of blood enters into the atria of the heart. So that is the activation of the against to the angiotensin. Next, which one of the following is the statement is correct? Is correct with respect to the kidney function. When someone drinks lot of water, ADH release is suppressed, and exposure to the cold temperature stimulates adrenaline. An increase in the glomerular blood flow stimulates formation of angiotensin 2. During summer, when body loses lot of water by evaporation, the release of ADH is suppressed. So obviously, when someone drinks more amount of water, ADH release is suppressed. ADH released is suppressed. Next, ADH is meant for balance the water amount in the blood. So ADH is going to maintain the balance of water in the blood. So we'll stop the number of questions. Remaining questions you can practice by yourself. Thank you for the day.